best in the nation in surgical quality, says the Institute of Medicine. Recognized by the Agency for Healthcare Research and Quality, the Institute for Healthcare Improvement, the National Quality Forum, the Joint Commission, the CDC, and already in use in hundreds of hospitals across the country, including the top 12 hospitals on U.S. News & World Report's Best Hospitals rankings. It's the American College of Surgeons National Surgical Quality Improvement Program, known as ACS Nsqip.
The Nsqip is one of the best programs, bar none, across the country for clinical outcomes reporting. So it's putting that on the table, because I think over the next 5 to 10 years, we'll be moving strongly in that direction and getting up front, doing it well now will stand hospitals and physicians in good stead over the next decade.
ACS Nsqip meets regulatory requirements, reduces preventable surgical complications, and is proven to save lives and money.
If you're successful in improving the surgical care of your patients, you're then going to get a significant return on your investment. You don't have as many infections, you don't have as many readmissions, you don't have as many complications that we know cost money, so everybody wins.
It's proven to prevent 250 to 500 surgical complications per hospital per year, save 12 to 36 patient lives per hospital per year, excel on publicly reported quality measures, and reduce costs by millions.
And we expect to save at least 200 lives a year with this. 200 lives saved and millions of dollars, of course.
And by reducing complications, we have done two things. We've saved lives of our patients, and also, again, by reducing complications, we have saved resources and therefore saved money.
I would say 99.999% of surgeons want to take the very best care of their patients they can, and they don't know if they're really getting the outcomes that they think they are until some good data is collected, and then they can compare themselves, and that's what Nsqip does.
ACS Nsqip is different and better.
So Nsqip, I think, represents the best tool that we've ever had to analyze institution-level quality data. Previous institution-level programs have usually been very surgeon-specific or procedure-specific, but having independent nurse reviewers and standardized definitions for the first time allows us to fairly compare ourselves to other institutions and to take the next step and make quality improvement projects within your own institution.
Over time, hospitals that use Nsqip will see other lasting benefits: a motivated, cohesive, and self-directed workforce, a culture of patient safety, better clinical outcomes, improved bottom line, and enhanced reputation in hospitals and systems, both large and small.
Quality improvement is extremely important to small hospitals. There are certain disadvantages that surgeons operating in small hospitals face. And so small hospitals find it practically very important to be able to demonstrate that their operative outcomes are at the level of procedures that are performed in larger hospitals.
ACS Nsqip will soon have 3 of its measures reported on the CMS Hospital Compare website.
I'm really very proud of the college and the quality programs that it has, and I think that, like adding Nsqip, I really think that every hospital should have it, and that when people ask me if they should trust a hospital in particular or a care system, I say, oh, well, look, if you're going to have surgery, see if they have this Nsqip program, because it's really made a huge difference in quality, and it makes sure that you do get the best.
Sometimes it's difficult for the layperson to know what quality means. They may not know exactly what your wound infection rate is or your leak rate is, but they sure as heck will know if you're a Nsqip hospital or not. So what you're looking for, I think, if you're in public, you want to have a good housekeeping seal of approval. And that's what Nsqip can provide.
Nsqip provides what the government, payers, patients, and surgeons are asking for. Join the hospitals around the country that know the difference, that use ACS Nsqip and are leading the way for better surgical care.